Why does urinary retention, often requiring catheterization? Imagine feeling like your bladder is full but being unable to empty it. That's what happens in urinary retention. It can be sudden and severe or develop gradually over time. When the bladder can't empty naturally, urine starts to build up, which can cause discomfort, pain, and even serious health issues. That's where catheterization comes in as a vital medical tool. Catheterization provides a quick and effective way to drain urine directly from the bladder. This immediate relief helps prevent overdistension, which is when the bladder stretches beyond its normal capacity. Overdistension can damage the bladder muscle and increase the risk of infections or other complications. In cases of acute urinary retention, which can be a medical emergency, catheterization is often the fastest way to restore normal bladder function. Many times, urinary retention is caused by blockages like an enlarged prostate, known as benign prostatic hyperplasia, or strictures and tumors that block the urine flow. External pressure on the bladder from other organs can also cause retention. When these obstructions are present, a catheter can bypass the blockage, allowing urine to flow freely and preventing further damage. Retained urine can lead to infections in the urinary tract, damage to the bladder muscle, or even impact the kidneys if the problem persists. Regular bladder emptying through catheterization reduces these risks by preventing urine from stagnating. It also helps doctors measure how much urine remains after voiding, which is important for diagnosing the cause of retention and planning treatment. There are different types of catheters used depending on the situation. Intermittent catheters are inserted periodically and removed after draining the bladder, which is often preferred for long-term management. Indwelling catheters stay in place for continuous drainage, usually used temporarily or when intermittent catheterization isn't possible. Suprapubic catheters are inserted through the abdomen directly into the bladder, especially when urethral catheterization is difficult or not recommended. From a bladder health perspective, catheterization is essential for preventing complications and maintaining normal bladder function. However, it is important to use it carefully. Prolonged use can increase the risk of infections, urethral trauma, and, in rare cases, bladder irritation or even changes that could lead to bladder cancer. That is why medical supervision and proper management are crucial. In summary, urinary retention often requires catheterization because it is the most reliable way to safely and efficiently empty the bladder, prevent serious health issues, and help identify the underlying cause. Always consult healthcare professionals for personalized advice and treatment options to ensure safe and effective care.